Hand hygiene is an important step before, during, and after a dressing change. You'll need a liquid soap or clean bar soap and a clean towel or paper towels. Begin by lathering up your hands with soap and water. Making sure you clean both the tops and bottoms of your hands thoroughly. Wash the space in between your fingers as well as your fingertips. After washing, rinse and use a clean towel or paper towels to dry your hands off. It's important to gather all needed supplies before you perform your dressing change. Use a clean surface to assemble the following items: a clean towel or chucks pad to be placed under the affected area and to create a sanitized barrier, a disposable plastic bag to collect soiled dressings and gloves, 3 sets of clean disposable gloves, ideally sterile, saline or wound cleanser as prescribed by your healthcare professional. This is necessary to wash your wound and the surrounding skin. Additionally, you will need a tape, clean scissors, gauze pads, and the prescribed dressings. The following items are optional: sting-free adhesive releaser to aid dressing removal and minimize pain, sting-free skin barrier to protect the skin under the dressing from potential irritation caused by the adhesive, a mirror to view difficult-to-see areas such as the underside of the foot. You should now have all necessary products needed for a safe and correct dressing change. Wearing clean gloves, remove the old dressing and dispose in a plastic waste bag. Dispose of the gloves used for a dressing removal as well. To begin, put on a new pair of gloves. Gently lift one corner of the dressing and slowly pull away from the skin. You can hold tension on the skin as you pull away the dressing all the way around. Then gently glide the dressings off. Dispose of the soiled dressings in a waste bag as well as your gloves. Begin by washing your hands with soap and water. Dry your hands thoroughly and apply a new pair of sterile gloves. Now you'll need gauze, clean tap water, or a prescribed cleansing agent. We're going to use a top-down technique to cleanse the wound, using gentle sweeping motions that allow you to remove loose debris from the wound. It's also important to clean the skin around the wound. Begin by taking your wound cleanser or tap water. You can saturate the gauze, or you can apply the cleanser on the skin surrounding the wound and in the wound itself. Using a top-down technique, begin at the top and with a sweeping motion, remove any debris from the wound. Proceed again from top to bottom, using a new piece of gauze with each swipe to ensure thorough cleansing of the wound. Make sure you clean the skin around the wound in the same manner. Dab the wound gently with the gauze to remove any remaining cleanser and debris. Make sure you use a fresh piece of dry gauze to dry the skin around the wound. Now that you cleansed your wound and prepared the skin around the wound, the area is clean and dry and ready to accept the dressing. Today's dressing change will be utilizing the AQUACEL Ag Advantage as primary dressing and applying a cover dressing, AQUACEL foam dressing. Before you get started, wash your hands with liquid or clean bar soap. Dry thoroughly with a clean towel or paper towels and put on a new set of gloves. It's helpful to have a clean pair of scissors available if you need to cut the dressing to fit the size of the wound. Open the dressing package carefully and avoid making contact with the dressing as much as possible. If necessary, cut the dressing to fit the size of the wound bed so it overlaps by at least ½ inch onto the skin surrounding the wound. Apply your primary dressing on the wound first. Use the AQUACEL foam as your cover dressing to hold the primary dressing in place. You'll notice the backside has plastic covers that need to be removed. Remove one at a time. line the dressing up with the wound. Try to center it on the wound, then just rub on the adhesive border to hold it in place. The bottom is now attached. You can pull the top portion up and remove, again gently patting the dressing down in place.